Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. And welcome back to another episode of the Keeping Ashland Healthy podcast. My name is David Ross. I am the boss, executive director here at the Mental Health and Recovery Board. And not with me in studio is Dr. Ashley Ackerman. She's out doing all kinds of things. I think she's collecting coal that she's going to distribute to deserving youngsters this Christmas season. We can only wish Dr. Ashley the best in her endeavors. But I wanted to take just a few minutes. I know we're getting towards the end of the calendar year. And one of the things I enjoy doing is looking ahead. We do a lot of planning at the Mental Health and Recovery Board. Anybody that knows me will know that I'm not one for spontaneity, which is why, just one of many reasons, I'm not invited to parties. It's hard for me to do anything spontaneous. I do like to plan things out, and I have an expectation that things go a certain way once they're planned, which, again, leads to all kinds of frustration. But back in the day, and I won't tell you how old I am, but I did watch Rudolph's Shiny New Year back in 76 and 77, and that was one of those stop-motion animated TV specials. It had a cast of characters, including Rudolph, the red-nosed reindeer, of course, Santa, but one of the favorite characters for me was Happy. I don't know if you recall Happy. Happy was also called Baby New Year, and he had extremely large ears that were revealed when his top hat was removed, and that always caused me to laugh, and it's been with me ever since, is Baby New Year. Those folks at Rankin Bass did this kind of stop motion stuff. It's kind of freaky if you're not used to, it's almost like Davy and Goliath, the claymation. It's a weird kind of special effect. But anyway, Baby New Year symbolizes what is to come. So I wanted to think about what's to come in calendar year 2025, what you can expect from your Ashland County Mental Health and Recovery Board this 2025. So just a few things to put on your radar and hopefully look forward to. This first one is important, even though it might sound a little boring, is the state funds services in Ohio on a 2-year budget cycle. So the next one coming up is for 26 and 27, and they also operate on what they call a state fiscal year, which begins July 1st. So fiscal year 26 actually begins July 1st, 2025. So you're going to see between January and June quite a lot of discussion about the state budget, and mental health and substance use services are a big part of that. So I will be involved, as well as the board members and staff, with trying to encourage our partners at the state, but also legislators to support hopefully increases in mental health and substance use services that flow to communities, flow to boards like ours. I have to be honest with you, the early indications are that the budget's going to be flat. That's unfortunate because our budget's been flat for many, many years now. And with the cost of everything going up, including, cost to employ the highest quality professionals in Ashland County, it's harder and harder to do that with a flat funding. So the 2-year budget cycle, be looking for a lot of activity between January and June around that, and we will certainly keep you apprised of those developments. The other big thing that happens on March 26th, and boy, I'm excited about this, is our 16th annual Pat Risser RSVP conference. Lots of podcasts upcoming on that, but just a teaser, that's March 26th at Ashland University's Upper Convocation Center. We will have 2 speakers for keynotes that I think will be dynamite. You've heard me mention Brooke Siem before, S-I-E-M. Brooke's book, may have side effects is incredible. It talks about her journey of coming off psychiatric medications after 15 years. This is still something that's not talked about nearly enough, and I love her book because it's written for everybody. It's not written for doctors, physicians, or for a highly technical audience. It's written for everybody, and that's what I love about it. It's so accessible. So this issue of how to come off psychiatric medications is explored, and just the effects in the story. We're bringing in Brooke to talk about her book, but also what we can do more in Ashland County to assist those that have made that decision to reduce or come off entirely some of the psychiatric medications they might have been prescribed. Coming with her is Dee Barbish. Dee is actually Brooke's mom, and Dee's story is fascinating in its own right because Brooke talks about starting the medications when she was 15 years old, and obviously that was done with Dee's consent. So Dee talks about her journey, what she knew or what she didn't know when she said yes to the prescribers that wanted to give her daughter medications beginning at 15, and what she's learned along the way. Some of her feelings about the healthcare system, and one of the other fascinating things is Dee ended up being a counselor in her own right. She helps people, and she's going to talk about Compassion Key, which is the model that she uses in assisting folks on their journeys. So Brooke and Dee, we will have more speakers, but these are two of our keynoters that I think will make the conference really special. We've really never tackled this issue before, so look forward to that on March 26th. The other huge issue is a levy. The Mental Health and Recovery Board has a 5-year, $1 million levy for mental health and substance use services. We've enjoyed great support over the 25 years it'll be in November of 2025 of that levy. Our board is right now discussing the best way forward and how we want to approach our voters about really showcasing all the things the levy has done to benefit the community. So hopefully come November 4th or a little before, if you take part in early voting, we'll be able to hopefully convince you that a yes vote will continue the kinds of quality programming and efforts that the board has been funding for the last 25 years. We will do several podcasts on the levy. We'll certainly take questions from folks throughout the year. I'll give some information about the board, how you can contact us. If you do have questions, we will do our very best to answer any and all questions that folks might have about those, levy-related issues. And then, of course, don't forget, September is always an extremely busy month for the board. September has been designated for many, many years now by our county commissioners as Suicide Prevention and Awareness Month. We anticipate that happening again. We cap off the month of September with a Suicide Prevention and Awareness Walk. That'll be September 28th, 2025 this year. Also in the month of September is we've got fair season. We love going out to Ashland County Fair as well as the Loudonville Street Fair. I think the Ashland County Fair this year will begin on September 14th through the 20th. We are a destination location at the Ashland County Fair because of some of the giveaways that we've created. The staff are wonderful in coming up with things that are both practical, but they have important information about mental health and substance use, about our contract partners, Appleseed, Acada, and Catholic Charities. I recognize a lot of folks don't always know the board and what we do, but my hope is always that they at least know our contract partners, because they're the ones that are actually providing the services in the community. Again, Appleseed, Catholic Charities, and Acada. Both the Street Fair and the Ashland County Fair are a wonderful opportunity for us to meet you. If we haven't had a chance to meet you in person, we can do that, and you'll get some wonderful giveaways. I tell you, we've got some exciting things planned for the fairs this year. Last but not least, in terms of big events, will be our October 22nd annual lunch. Still working on a keynote for that, but we like to wrap up, our fiscal year in October by breaking down what's happened. Obviously, we'll still be in that levy mode, so we'll talk a little bit about the levy and answer questions then. Some of the other trainings I wanted to make you aware of is our ongoing partnership with Ashland University and the Question, Persuade, Refer, which is, again, our primary evidence-based practice prevention strategy to make anybody aware how they can save a life from asking the question, persuading the individual to get help, and referring them. The training only takes an hour, at minimum an hour. We can go to an hour and a half if you can give us the time. We offer that at any organization or group at no cost. But, thousands of folks in Ashland County have been trained in this model. We know, based on reports, that it's saved lives. So those trainings, QPR trainings, will continue throughout 2025 in a variety of locations, but you can always call the board at 419-281-3139, and we'll schedule that with you. Hopefully, you'll also come and see what we're doing on our webpage, www.ashland. I don't even know. Do people say www? I don't know. 3 W's. ashlandmhrb.org. We've got all kinds of great resources on our webpage. And of course, social media. Now, Dr. Ashley isn't here, but I let her handle that because she's quite a bit younger than I am, and I don't understand it. But I know we post a lot of cool stuff on there. So if you're on Facebook or Instagram or LinkedIn, I know we have a presence there. We also, our YouTube channel is getting, I think, more and more popular. We like to put these podcasts on there as well. So please check us out on YouTube as well. Like us. I think that's something you can do on that. So if you enjoy or make comments, only if they're nice comments though. But no, if you have some comments that you'd like to make to help us improve what we do or how we do it, please do that there or call the board. I just want to say, as we end 2024, it's been a great year. I just enjoy the support of the Ashland County community. Folks in this community get it, whether it's north, south, middle. Folks seem to understand that it's really hard to have a fulfilling life if all areas aren't being addressed. And, you can have all the money in the world and all the great physical health, but if your mental and emotional life isn't where you want it to be, those other things aren't going to make up for it. And vice versa. You can be mentally and emotionally healthy without being physically healthy, and there's going to be an impact. So we really emphasize that holistic health perspective, and mental and emotional health is just part of that. But we work tirelessly with our partners in the community to have that well-balanced, well-rounded view of individual health. So on behalf of the Mental Health and Recovery Board, let me just say this will probably be our last podcast of the year. Wishing you and yours a very happy and merry Christmas, as well as a safe New Year's Eve, New Year's Day. So this is the boss without, like I said, Dr. Ashley. She's out rustling up some coal, signing off for calendar year 2024. Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in Keeping Ashland Healthy.